So good morning, everyone, and welcome to our monthly regional abatement LGU collaboration meeting that we hold. Today we are going to just check in on some very brief updates with regard to the regional abatement. And then we are going to have Brenda Harris-Collins, who's the director of the Bureau of Recovery and Social Needs, discuss with us recovery residences and kind of new and what's happening in that area. So just as a reminder, asking folks to please mute your line if you're not speaking. I do see that we have a number of folks from OASAS who are on, and I appreciate folks joining. We're not going to go around and do introductions because there are so many of us who are on this morning, but appreciate everybody participating. So in terms of the Opioid Settlement Fund regional abatement, we do have our next round of reporting coming up in the very near future. So know that we will be sending you all. So this is for the LGUs, the 5 large cities, the other litigating entities. We will be sending the report link to you. I believe in looking at the calendar, it will be March 3rd that we send that out. March 1st is on the weekend, I think. So we'll be getting that out to you on March 3rd. We do ask that you submit the report by close of business on March 31st. And that report will reflect dollars in play and what you have utilized through calendar year 2024. We are moving to hopefully be able to provide in that report more detailed information with regard to the dollars that are available, information as it pertains to fiscal year. And as you know, we've added reporting on the direct share to the work that OASAS is doing. And in a number of instances, the LGU is acting as the reporter with regard to the direct share amount as well. So to the extent that we're able to identify and be very specific about amounts that were provided around direct share, we're going to do that. So in terms of how the report looks, the format may look a little bit different in that we're going to try to provide more information and hopefully more clarity around the amounts and what it is that folks are reporting out on. We had talked about in the fall also perhaps expanding on the information we're making available to the public on our webpage. We talked about increased transparency. We will still need to have conversations about what that could potentially look like, what that will look like. We will continue to list amounts that are made available, and we're interested in being able to report as much as we can as we're ready and able to present more information. So that conversation still needs to happen amongst this group before we make any actual changes to the web page and what appears there now. So again, just a reminder, if folks could mute their line unless you're speaking. I believe for regional abatement, the reporting is our next big step. Do folks have any questions or comments with regard to reporting or any other regional abatement related questions? Feel free to unmute or raise your hand and unmute.
Hi, Connie. It's Suzanne.
Hi, Suzanne.
How are you?
Good.
So initially, when we did our intended use of the funds with the last round of reporting, we've made some changes in how we're applying those funds to other activities. So how will that be captured in terms of, making changes to the use of the funds?
Yeah, so it, the expectation when we first asked you to report out on planned use of funds, the expectation was that there was so much we didn't know, right? That was the very beginning. And we well expected that there would be changes, right? As you learned and had conversations and as things unfolded. And so if there are changes to be made, I think it's best that that be reflected in the amounts that have been made available. So how we talk
Okay.
about what's been made available. So it's not so much about what you thought or what you had planned previously. We're really focusing reporting on what's actually been done. So know that the focus is on what you have made available, what dollars are in play. So that is where we're going to focus as opposed to talking in terms of planned.
Okay, great.
Other questions, comments that folks have?
Connie, this is Jay.
Hi, Jay.
So at least in St. Lawrence County, there was some confusion about who should be reporting out the monies for the county allocations of the settlement funds. So moving forward, those reports will be sent directly to counties and not the DCSs.
So thanks. And I think that this is still an evolving process. And so when so reporting on the direct share, we had targeted the reports to the contacts that had been provided to us by the AG's office. After that initial report request went out, there were conversations that happened at the county level where I know you all and others within your county discussed kind of who should be reporting what, like who takes responsibility for that. In some instances, the county decided that the LGU would respond to both reports. So where folks have shared that information with us, we have adjusted our email list to whom we'll be sending those reports, so that folks who have been identified by the county and who are designated by the county to report will get that link. So Jay, if we've been told there's a new contact or who the contact should be for the direct share, we will send that accordingly. If you want to check in with the project management mailbox to make sure that we have the correct email addresses to direct that, we will.
Okay, great. Thank you.
Other questions or comments? All right, always keeping in mind that there is always more coming. So just noting we are currently utilizing funding through state fiscal year 25. Once we have a new budget in place and we have dollars, we will be moving forward with making those funds available. We'll get through the report for 2025 first. Any other comments or questions, concerns? Okay, so with no other, I don't see any other hands. I don't see that there are other questions in the chat. At this point, I would like to introduce Brenda Harris Collins, who, as I said, is going to be talking about recovery residences. Brenda, thank you. Very happy to have you here today, and I'm going to turn it over to you. Can't hear you, Brenda. I know that your microphone looks like your microphone through Teams is on, but we can't hear you. Jeff, I see that your microphone is open.
Yeah, I can get started. Brenda's having some audio issues. Just want to introduce myself, Jeff Strauss. I work with Brenda in the Recovery Bureau at OASAS. We just want to talk a little bit about recovery residences. Brenda's going to work on getting her audio fixed, but I'll just get us started. Thank you so much for having us today. We really appreciate it. So we actually jumped on a meeting a few months ago, I believe in September, just to talk about the certification that would soon be launching under OASAS for recovery residences. And we wanted to jump on again just to tell everybody that we do plan to launch by the end of this month, by the end of January, the voluntary certification of recovery residences under OASAS. So you may have heard that the 860 regulation was adopted on September 25th last year, 2024. It went through a revision process and was adopted in September. So it's now a commissioner priority for us to officially launch the certification by the end of the month. It will be the first recovery support service to be certified in New York State. So the certification allows existing recovery residences and new recovery residences to apply for OASAS certification. And the goal is to expand the continuum of recovery supports throughout the state by increasing the landscape of safe, quality recovery residences. So we're going to have a webpage on the OASAS site. It's been finalized and will launch by the end of January at the same time the certification launches. So we'll be sure to share that link with everyone here. That webpage will have the certification application. It will have steps to apply, as well as a bunch of relevant operational guidance documents. We're going to have different documents such as guidance, foundational principles, best and promising practices, resident rights, and a lot of documents just to support initial operations and ongoing operations. So we're also going to have a press release and communications announcements from OASAS at the same time. We're going to have a training system that we actually contracted with a third-party vendor to have trainings on recovery residences. That will be for applicants as well as staff of the recovery residences for the trainings. And staff from the Recovery Bureau, as well as OASAS certification staff, will be able to help applicants through the application process and provide support as needed. So that's kind of like our first introduction. We have a couple more topics. Just seeing if Brenda was on. I think she's probably.
Can you hear me? Can you hear me now?
Yeah.
Okay, great. Thank you. Okay, go ahead, Jeff. I'm on.
All right. So we also want to hear any feedback or questions at the end of this kind of update that we're giving everyone. In addition to the certification launching, we also are announcing an RFA for one-time award dollars. In order to support these programs, OASAS is offering up to $5 million in one-time funding, total $5 million through the opioid settlement fund. So residences who are interested in applying for the one-time funding can be awarded up to $75,000 per individual residence, per individual house. They must meet certain eligibility criteria, and they must complete a separate RFA application. So the funds cannot be used as startup costs or sustainability funds or to pay staff. They're used to enhance the operations of the recovery residence. And we have a lot of details on, the categories of allowable spending. So the money is not, the award dollars is not to be used to become certified. It's basically that the applicants, the residences, will complete the certification process. They'll receive a contingent certification announcement from OASAS. And then at that point in time, applicants may apply for award dollars. We know that there are organizations throughout New York that have multiple residences. And so in terms of the funding being limited, it's set up so that organizations can apply for funds up to a maximum of 3 houses. So that would be $75,000 times 3, up to a total of $225,000. In other words, resident organizations that have 10 residences under their organization, they could apply to have all 10 be certified under OASAS, but would be eligible just for one-time funding up to 3 residences. Of course, they have to submit a budget for the funds and show how the dollars would be spent in order to enhance their operations. So we're hoping that this kind of one-time award will also help to kind of get the launch and the certification going and get residences interested in applying, as well as supporting the landscape throughout New York State. So we'll talk a little bit more about the RFA, but do you want to talk about our next section?
Yes. So one of the things and reasons why we wanted to definitely be on this meeting to present about the certification of recovery residences and that this is happening is that the LGUs throughout New York State, along with OASAS Regional Office, will play a critical role in the certification process. So as Jeff has told you, that we have an application process, we have the funding, we have documents that will all be posted on our website. But as we start the launch of this at the end of January, um, applicants will begin contacting their local OASAS regional offices to begin the prior consult process. These individuals will be meeting with the regional office and the LGU, and the applicant will take place, and this meeting will take place prior to submission of a full application. The application process is a modified process from a normal application for a treatment provider. This is a recovery provider. So it's really understanding what the recovery residence is supposed to do and how they are supposed to uh, comply with the regulations. Um, we are also asking that the OASAS Recovery Bureau staff, we're requesting to be invited to the prior consult meetings. So as we are going through this process, and one of the things to let you know, we have no idea of how this is going to go. We don't know if we're going to have quite a few applicants. We have no knowledge if nobody's going to apply. So it could be from trickled all the way up to quite a few applying. So we don't really have an idea of the flow of this. We also want to, each certified residence will have a liaison from the Recovery Bureau as well as a designated regional office program manager because it's certified. Initial site reviews of the physical site will be conducted by program review unit. So it is a process that we are going to be again. And again, we're already at January 22nd, so that's within the next week or two. We should be opening this up and launching this. There will be a press release. There will be other things that will be a part of the launch, but we needed to make sure that you are aware that this is happening. Jeff will talk a little bit more about the prior consult process.
Right. So we mentioned, existing residences could apply for this, as well as individuals who are interested in starting a new residence. Brenda kind of touched on it, but the applicant's going to first reach out to OASAS regional office. Regional office will get in touch with the individual LGU for that area, to start a conversation. The residence is going to present, why there's a need for them to be in that area, how it's going to help individuals in the local community who are in recovery. And we know that, you're all familiar with this, but we just want to kind of mention, like Brenda said, it could be a lot of applicants. It could be very few in the beginning, but we just wanted to make everyone aware that, new prior consult meetings will kind of be on the horizon here with regional office and LGU staff. The reason why that we kind of love if, the Recovery Bureau staff could be invited to those prior consult meetings, just to provide kind of background and insight on recovery residences and just different aspects. This is very new to New York. This is very new to a lot of counties, not all of them, but to some counties, this is going to be very new. So we would just be happy to provide insight in those meetings into recovery residences and, what we've learned about them, and possibly ask some good questions of the applicant during those meetings. So that's just a little bit about the prior consult. Brenda?
So, previous OASAS landscape, again, we don't know how many recovery residences exist in New York State. We have identified approximately 150, but we know that there are more than 150 in New York State. We have done some research, and we have between one researcher said over 1,000, one researcher said about 250. So it could be anywhere in between that. We've collected contact information and emails for many of the ones that we have found. We have visited them. Um, just please note also that the Oxford House or NAR, there in the regulations, there is no specific reference to them. Although they are nationally recognized, OASAS has chosen not to use these specific models, but instead we have a New York State unique model. You are aware that the reason why we're doing this is because over the years, there have been some bad players, and we really want to establish standards so that we can, so that individuals who are really seeking stability and to be able to have this stability and not be harmed are not harmed. But this New York State model that we have put together really puts in some of the very guardrails that need to be available. The goal is not to exclude any model or organization, so we want to be clear about that. Any model or organization could still apply and discuss how to meet the eligibility criteria for certification. So we just want to make sure that they know the way that they have to be able to comply to the standards and the regulations that are set aside. So that's where we're at, and that is what's happening. And I know I saw some things in the chat, and so just want to definitely open it up for questions. And someone put in, will an announcement and or flyer be provided on this program so we can distribute to possible applicants? And so I know that there is an announcement, a press release that will go out. We can definitely, that's something, Jeff, that you and I can make sure that we have something that can be distributed and that we can send out along with that press release or along with whatever announcement. There will be a provider announcement that will be released as well with the OASAS communications team. Will release something, but we can see how we can make sure that this can be distributed to possible applicants as well. Because we do know that there are non-existing people who do not have recovery residences that are interested, but especially those who are. One of the things that's going to take place is once they are certified, they will be listed on the OASAS website so that individuals who want to go to certified recovery residences will have a listing of where those recovery residences are. When will the trainings for this certification begin? So as soon as we release the so there's a lot of things that we have to do for implementation. So let me start there. So one of the things that we're going to do is that we have engaged with a learning management system so that we'll be able to, individuals who are interested in finding out information can go to the learning management system with Fletcher Group and be able to find information. We will be doing some specific webinars going forward. Just want to let you know that there is a Learning Thursday on the OASAS website that gives really basic information about the recovery residents, but we will be doing some webinars to explain the 860 regulations, to go over guidance. So we're in the process of developing those webinars that individuals can take a part in, but we also have this learning management system that will allow for trainings, and when necessary and when possible, we can also do some additional Learning Thursdays so that people have access to information. We want individuals to have the access to the information that will help in this. So we will be doing that. Any other questions specific to this? And again, you can put questions in the chat in regards to this.
Just want to also mention, we're going to have a separate web page that goes live for the RFA award dollars, you know, with that application and explaining eligibility and all details related to the RFA. And then we'll have our separate recovery residences certification main page on recovery residences. So we'll be sure that everybody in this meeting gets the separate web page links to both of those. They will be going live on the same day. Just wanted to let everyone know.
Okay, and we're really excited about this and having this first initial recovery support. And hopefully that this will, I know housing is an issue, and that this is the combination of housing and recovery supports together is really important to all communities to expand as another option, but also to have these standards in place is really, really important. So thank you for all that you do for your communities where you are in.
Terrific. Thanks so much, Brenda and Jeff, for that. This has been a huge effort and it's taken, you know, a lot of time to craft this, to put this together, so much work on the part of Brenda's team. And thank you to the regional office as well for your role in this and for attending today. So that process and all that Brenda talked about is forthcoming. There will be, as I understand it, a release within the next week or so. So know that you will see information on that. We will, of course, be sending an all provider send, make sure that LGUs are included and notified, and also share with Courtney Davis at the conference. So she'll be also forwarding and sharing information to be sure that everyone is aware of the availability of the application and the funding and so forth. I know that if there are no other questions with regard to recovery residences, and I shouldn't say there are no other questions, I think there'll probably be lots of questions, right, forthcoming. So as the process rolls out, there'll be additional questions, and certainly please feel free to reach out to ask us about those things. I did want to circle back to the chat. I was negligent. I didn't realize that there were a couple of comments that had been made with regard to the regional abatement portion of the conversation. And I believe Laura had made a comment asking if there's a narrative option in the reporting to talk about the work that you're doing. And Lucia was checking, but I believe that there is opportunity for you to enter narrative now. Certainly if that isn't pre-existing on the report format, we will include it. And along those lines, in terms of talking about the projects that you're doing, the work that is underway, remember that when we first started this, we said that this reporting will evolve over time. And I think as more work is happening and more is underway, you know, we will want to know more. We will want to hear more from you in terms of the work that's being done with the regional abatement funding. Along those lines, for awareness, we did award NYU in our government academic partnership research opportunity that is funded through the Opioid Settlement Fund. And they are going to focus on and be looking at the regional abatement portion of the funding. And so we are working with them to craft what those questions will be or what aspects of the implementation they will be looking at. And I do fully suspect that that will be an opportunity for counties to talk more fully about the projects that they're doing and the work that's underway. But we will have more information coming on that once we have fleshed out the scope of work. So no more conversations on that will be happening in the spring. The other comment about the national reporting. So I believe that in terms of the national, the entity at the national level that sends out the direct share dollars and requests reporting, my understanding was that they had established a contact at the county level to request reporting around the direct share. I will ask the Attorney General's office for additional information on that. And I understand too, when we had first started to ask folks to report out, there was some confusion because there had already been a request from the National Settlement Group for reporting from entities that had received dollars. So I'm going to get additional clarification on what their cadence is and what their expectation is, and also who they're contacting, so that we can all be on the same page and be super clear about all of the reporting. So I will get additional information and I will report back to you next month when we meet on that. If folks are willing and able, if you could share what the national report looks like, or what information they had asked of you. If any of you have that and you can email me with that, that would be helpful, just to help, inform my conversation with the Attorney General's office. And again, get us all on the same page, because I know there's a lot of moving parts to all of this, of course. Okay. And then there's a comment that there are contacts. It's just that there wasn't a lot of information. I'm looking at the chat. There was not much information to distinguish the multiple reporting obligations. Okay, so we will try to really clarify and articulate which reports for whom and why, and also know that we are working with counsel's office to really look at individual settlements regarding reporting requirements to make sure that we're covering all of our bases. So we will certainly include the national settlement reporting obligations in that as well. So we can circle back on that.
So Connie, it's Suzanne. I can chime in on that. I know that I recently received an email reminder with a link to, do the reporting for the AG funds. I have a note here in the email that says it's due, reporting must be done for 2024, due by February 14th, 2025. And when I did the reporting last year, it was pretty simple. Just a few required data fields. I mean, there wasn't a heavy lift in terms of documentation and the reporting. They just wanted to know how much had gone out and, if it had been encumbered or actually distributed. So it was a pretty easy lift to do that reporting.
Okay. But good for everybody. I mean, for our awareness, and so that everybody's on the same page, that there is that reporting requirement, which is separate from our reporting requirement. And again, each settlement has language around reporting. So we do want to make sure that we're all aware of and covering all the bases. So thanks for that, Suzanne. So folks are aware of that, and hopefully there'll be a degree of coordination so that we're not asking too much of all of you at every point in terms of the different groups that may be asking for reporting from you. We're trying to streamline and be efficient and consolidate as best we can. So if you have comments or feedback on that, I'm always interested in hearing that and seeing how we can improve. And like I said, it's a process that will evolve for sure. Okay, any other questions or comments from folks? I think that all that information on recovery residences is great. I think Brenda and Jeff, thanks. You gave everyone a lot to chew on there. And like I said, there's going to be more coming. We will be talking next month. Actually, Lucia and Kristen can remind me. We may be talking about SOAR funding at our next regional abatement meeting. And we will be on the verge of sending out the reporting link for 2024 when we get together again in a month. If in the meantime you guys have any questions or concerns, please don't hesitate to reach out to the OSF project management mailbox or to me directly. Of course, if it's regarding recovery residences, not those two things. In that case, you have Brenda Harris and Jeff Strauss to reach out to. Again, I hope you're all staying warm. And remember that spring will come. It's inevitable. We cannot stop it. It's just a matter of time. So stay warm, drink some hot cocoa, and we'll see you next time. Thanks, everybody.
Thank you, Connie.